To help visualize all of this, I brought a deck of cards with me, not as a means of showing a misspent youth. But I brought a deck of cards. Which I will shuffle so that hopefully these cards are as mixed up as I am. And I'm going to ask you please just to say stop at any time to it. And then I will take these rubber bands and rubber band the deck shut. And now in a moment, I'm going to pass the deck to several tables. And when I hand you the deck, I'm going to ask you please just to take the deck, to crack it open, look at a card, drop it back down. Please remember your card, and then I'll ask you to stand up. And then I'll get the deck back and I'll hand it to someone else and say, please crack the deck open, look at a card, remember it, and then stand up. So I will come first. May I hand you this deck? And I'm going to ask you please to take it, crack it open, look at a card, remember that card, drop it down, and I'll have you stand up. Thank you. And I appreciate all of those of you who are willing to participate. I thank you. May I hand you the deck? May I ask you, please, Dr. Allen, have you crack it open, look at a card. Please remember that card. I'll take the deck back, and then I'll have you stand up. Very good. Thank you. I'll come across. I don't want any side of the room to feel left out. May I hand you the deck? I'll have you crack it open, look at a card, remember it, and then I'll have you stand up and I'll take the deck back from you. Very good, thank you. And may I hand you the deck? Thank you. I'm going to have you crack it open, look at a card. I'm going to ask you please to remember that card as you stand up, and I will take the deck back. Very good, thank you. And we will do one more. May I hand you the deck? I'm going to ask you please crack it open, look at a card, remember, stand up, and I'll take the deck back. Thank you. Now, a deck of cards, shuffled. Just as patients present to our practices as if from a shuffled deck randomly dealt into our schedules every day. We see them. First thing we want to do is establish rapport. And then we want to do our best to understand what's bringing them in to see us, making an accurate diagnosis, obtaining informed consent before we intervene and treat. Now I'm going to ask each of you, if you will, because I don't want to be reading body language or facial signs. I'm going to ask you all please to turn your backs on me, if you will. I won't consider that as a sign of rudeness. I'm going to have you all turn your backs, and in a moment, I don't want you to do anything yet. I am going to call out 2, 3, 4, 5. Please picture the card in your mind's eye, because I'm getting the impression of a 3 of clubs, a 5 of diamonds, an 8 of spades, a queen of hearts, and a jack of clubs. If I mentioned your card, please turn around and take your seat. Thank you. Please hold your applause. Thank you. We have one more card that was selected at random from the shuffled deck that none of us have seen. Am I right? Dr. Booth has it right here on the table. 52 cards plus the 2 jokers are in that deck, because you'll notice I left the jokers in the deck. One card was selected out of the 54. None of us have seen it. None of us know what it is. However, this card helps us to realize when we talk about medical legal issues, we also want to be aware of the need for insurance. malpractice insurance. You see, even as a magician, I have to carry insurance. I have the magician's insurance policy. And what you will notice, the policy says it has conditions. What is the most common contract entered into in the United States? The insurance contract. What is the least often read document in the United States? It's the insurance contract. So my insurance policy has to provide me everything I need. And I'm going to ask now, if you will you please, Dr. Booth, will you please pick up the card, show us what it is, and announce out loud the actual card. It is the
King of Hearts.
The King of Hearts, and hopefully our insurance policy covers everything we need. Thank you all very, very much. It was a real honor and pleasure to be here today with you all. Thank you. Thank you.